Sir, I'm very happy that this motion came in this session today. Even though I tried to brought this same motion in the last session, but it could not come. So you may surprise why this subject is so important to me and why I tried to bring, even though it doesn't come in the last session, but I decided to try this session again. And I must thank the Assembly Secretariat for allowing this motion to be taken up today. Sir, I may not be a right person to speak on this subject, but I'm happy that in front of me we have got many doctors, we have got medical doctors, specialist doctors with us in this Akos House, and it will be very, very good for the benefit of this Akos House and the people in the state at large if medical doctors can participate, if they wish to participate, to bring more light on this motion. Sir, people may think, and we members also may think, what is this comfort care treatment? And most of us, we don't want even to discuss, and we don't want to avail this service or this comfort, because it speaks about the end of our life to get such kind of comfort. So we don't want, but the fact is that everybody will have to pass through this at the end of our life. Even though we don't want, but we will have to experience this at the end of our life. Sir, if I look to some dictionary who explain about this comfort care, different dictionary may say different words, but one dictionary which I would like to read out here, it says that comfort care treatment is the comfort care treatment include physical care, emotional care, social care, and spiritual support for patients and their families. The goal of comfort care is to control pain and other symptoms so the patients can be as comfortable as possible. Comfort care may include palliative care, supportive care, and hospice care. This is the dictionary, sir. Sir, talking about the comfort care treatment, we understand that it requires to those patients who are facing chronic diseases and to the patients where they are struggling between life and death. There are times that doctors feel the need to disclose to the relatives that this patient, it is not possible to cure anymore, and we find it very difficult to have hope to cure these patients. There are times that doctors they felt the need to disclose the stage of the patients to their relatives. And we know when such information comes to the loved ones, to the relatives, to the attendants, we understand the emotion of the attendants, of the loved ones, of the patients at that point of time, sir. And most of the time, the patient, the relatives or the attendants, when such information came to their knowledge, what they do, most of the relatives, especially the poor people, the poor family, they opt to take the patient back home. When such information has been brought to them, that this patient, it is not curable anymore. So the poor families, of course I'm not talking here about the rich families, where we can afford better treatment, to go to a private hospital, to spend in a private room, and to get all the facilities that is available in the hospital. But I want to discuss here about the poor family who cannot afford such facilities. And I am really concerned about the poor family, poor patients, and maximum of the patients who are there in government hospitals, sir. It is poor families. It is the patient who come from poor families. So we understand, sir, when such information brought to them, what they do, most of the time, they decide to take the patient back home. And we can understand one thing, that in a poor family, what can these poor people can give, what kind of treatment in their homes? It is not possible, sir. It is not possible to give the treatment that is required to the patient at their home. They cannot do anything. The only comfort is that to the attendants, they will feel free when they reach home. They are free from that hospital atmosphere for which they don't like. So when they go home, they are more relaxed and more happy. But I'm talking here about the patient. The patient, when he has taken back home, he will face all pain and agony. And who can take care of such kind of patients at this poor home, at their poor family, sir? So why I'm so concerned for this subject, even though I said at the opening remarks that I may not be the best person to speak on this subject, but because I have the opportunity in the family to always talk about health matters, about health subject, because I'm fortunate to have my daughter who is a doctor, and I have my wife who is a nurse, and myself also, I'm privileged to be a student of MBA in hospital and healthcare management, for which I'm still studying, sir. So that's why I have the patience to spend time to think, and I have written also in my assignment on this matter. Sir, it makes me more concerned when I know some families are facing such kind of problems in the rural areas. I will not name the village. I will not name also that particular patients. But I know there was an instance that one patient committed suicide himself because of the non-availability of such kind treatment at home. One patient, after taking 4 or 5 hospitals, from one hospital to another, and their families, they are poor family, they find so difficult to spend. Whenever they take that patient to hospital, the hospital, they keep a long list of prescription of medicines, and they have to buy those medicines. But this poor family can no longer afford to provide those medicines that are required for that particular patient. And at the end of the day, they also understand from one hospital after another that the hope to cure this patient, it's not there anymore. So ultimately, what they do, they understand this and they take that patient back home, waiting for the time to die. But that patient, he didn't die for so many days, so many months. The family member, sorry to use this word, they thought that they will take home, and they know also that he is going to die after a few days. But he didn't die. So ultimately, this patient, he has to face the pain and agony every day. And he don't dare also to tell the children to go to hospital again, because he know the condition of that family. It is a very low income group family. And he knows also the fact that he had spent during the treatment all the resources that he have. It has been spent already. So he has to face this pain and agony at home, sir. He has to face the pain and agony at home every day. And what happened? On one fine day, when he sees that there is an opportunity, when all his children is not at home, he took that sad decision to hang himself, and he died. This incident sorry, sir. I'm emotional on this. I'm emotional on this matter. This incident has touched my heart. And I thought the government can do something to prevent such incidents. The government can do something to prevent such incidents because we have so many poor people, so many poor patients in the state of Meghalaya who cannot afford this costly medicine, who cannot afford the required medicines which are required, especially those life-saving drugs which are very, very costly. We understand how many poor family can afford. That's why, sir, I bring this motion for discussion in this house today. That as a government, I do not know. Honorable Minister in charge Health and Family Welfare, she is the best person to know what kind of treatment do we give to such kind of patients who are struggling and whom we know also that it's difficult to cure. What kind of treatment as a state government we are giving as of now? But to my knowledge, sir, most of the poor patients, they came back home when they know that they are not able to cure anymore. Sir, I want to draw the attention of the government through this motion that it's very, very important to create such facilities. And if the government can give the direction to the doctors to classify and the senior doctor to determine, to declare which patient, who is the patient who required this comfort care treatment. If it's not there in the subject of the health department, I felt it is very, very important to have that classification, that patients who reach at that stage due to chronic diseases should be given that classification as comfort care treatment. And when the doctor declares that this patient needs comfort care treatment, the government should bear. The government should provide free of cost medicine, whatever the cost may be. The costly medicine, the injection which is very costly, painkiller which is needed is very costly. The government should bear such medicines when required to administer to service to such kind of patients who are struggling. Another suggestion, sir, which I want to bring to the government through this motion. Sir, private room, it's very, very important to give to such patients. Normally, private room is given to the patient who can pay. But I would urge the government of the day that such patient who get that classification from doctors should be given free of cost to a private room. Why we need such facilities, sir? Why we need private room? As the dictionary I've read that comfort care includes emotional care, and spiritual care. Sir, I want to tell you the fact that spiritual care is so important in such cases. People, it is very, very important, and we believers, we believe in our different religion, but one thing which we do believe is that emotional and spiritual care is so important at the end point of our life. It's very, very important. Patients are tending always to confess even their sins that they have done, and they need a spiritual healer at that point of time. Do you think that the general ward in the hospital is a suitable place for the patient to confess their sins? Do you think the general ward is a suitable place for the fathers, for the pastors to perform their religious performance at that place? No, sir, it's not suitable. And there's time that the patient, he don't want to disclose even to their own family, but they want to have a consultation with the spiritual healers. So until and unless they have a private room, they have a privacy, how can they disclose such kind of things? For which it's not necessary for them to disclose to their families, members, but they want to disclose to their spiritual healers. So it's very, very important to provide them a facilities so that they can disclose their things for which they want to disclose only to the particular persons. Sir, there are some definition also who says that to provide a comfort care mentally and emotionally and also physically, it needs to be present there physically, try holding hands or a gentle massage to the patients, and then set a comforting mode. Some people prefer a quiet moment with few people only. And then some patients may prefer even to listen to music with low volume. That also should be provided if required. And this will help the patients with relaxation and to reduce pain even. And then another thing it says, that it needs to involve yourself with the patients, especially the attendants, the loved one, the relatives should involve with the patients, and always to be present with the patient, especially the loved ones. So, sir, my conclusion remark on this subject is that I want to see the government of the day, the state government, if we have such facilities, if we have such care, can we improve it? Can we do better? And if we don't have, so far, Honorable Minister in charge, Health and Family Welfare, she's here with us. She knows better whether such facilities, such classification is there or not to the patients. I would urge this government of the day, sir, to bring this new topic, this new subject in the government hospital, to have a comfort care facilities to the patients who are facing with chronic diseases and who are struggling between life and death. With this few submissions, sir, I conclude my speech. Thank you.